Hello YouTube fam, this is Kiroho, Plant Built Body. I was just coming to you today to talk about hypertension or high blood pressure. It had plagued me over the years and just recently got it under control. So I was going to tell you where it started and what I've done to correct it. Well, it started a few years ago. Blood pressure started creeping up. I noticed that I went to get a physical and my blood pressure was like, at that time, was like 160 over 105. Now, I was 400 and some odd pounds at that time, and the doctor wanted to put me on medications. So he put me on a water pill because my ankles were swollen, and he thought that that would help. So I started taking the water pill. The blood pressure started going down a little bit and started creeping back up. I went back to the doctor because I was having headaches, and he put me on another medication, and I tried that for a while. It didn't work for me. It had side effects that caused acid reflux really bad. I couldn't sleep at night, had restless leg syndrome, so I wanted to cut all those out. So I needed to start looking for better ways to control the blood pressure. So, and started looking on the internet, you know, just basically doing research to find out how to control blood pressure. I tried everything. I tried cayenne pepper in warm water. That made me throw up. I tried celery water, you know, just blend up 4 celery stalks in some water and guzzle it down. And that's nasty. And it worked for a little while, but then the blood pressure went right back up again. And then I even tried, you know, you go out and you try to start walking. I tried to eat garlic. I was eating like 4 to 5 cloves of garlic a day, and all would help a little bit, but then it would still creep back up. So I went back to my doctor and I was trying to find out, like, okay, what's the cause of high blood pressure? And he would give generic things like, oh, you're African American, or you're starting to get a little older, you're carrying too much weight, and all those might have small contributing factors. Well, the weight has a bigger contributing factor, but those aren't the main causes of high blood pressure. So I went back to the internet to look and find causes. Now, on the research that I've done, I found 3 main causes of high blood pressure. The first one is insulin resistance. Basically, eating certain foods causes, basically eating certain fatty foods causes fat to get into the cells. It's called intramyocellular lipids. Now, that's basically just fat inside the muscle. What happens is when you eat certain fatty foods or certain meats, as you digest them, fat gets clogged into the cells. So when your sugar starts to rise, and when your sugar rises, you have insulin that allows the sugar to get into the cells. So basically, every time you eat something, your food turns to glucose. Glucose is sugar. Sugar runs into the bloodstream. It goes to the cell, and it can't get in the cell without being invited by insulin. So every time you eat something, you get sugar. Insulin goes with the sugar and goes to the cell, basically knocks on the door and says, hey, sugar is with me, and puts the sugar inside the cell. What happens when you eat a fatty meal, you get fat inside the cell. So when you eat something, your sugar rises, and then your insulin, you know, your pancreas releases insulin. Insulin goes to the cell with the sugar and says, hey, okay, sugar needs to get in, tries to unlock the door so sugar can get in, and sugar can't get in. So your pancreas doesn't know what to do, so it creates more insulin. So when in creating more insulin, because you have a buildup of sugar in the bloodstream, that also raises blood pressure. Now that's called metabolic response, you know. So you have metabolic syndrome. That's a precursor to pre-diabetes. Diabetes is done in 3 stages. I'll talk a little bit more on that in my next video when we'll talk about type 2 diabetes. But this is for hypertension, and that's just one of the reasons that your blood pressure starts to rise. Another one is due to endothelial cell function. Endothelial cells is a thin layer of cells that's on the inside of your veins and your arteries. It allows the release of nitrous oxide. Nitrous oxide relaxes the arterial function, so as your blood pumps, your heart pumps blood, your vessels expand and contract. Well, the endothelial cells allows your nitrous oxide to get inside the walls, so when the blood pumps, your arterial walls relax and allows for good blood flow. Well, those are damaged due to cholesterol. Now, cholesterol is only found in animal products. No plant makes cholesterol. And the two things that have problems with that raises cholesterol is saturated fat. Saturated fat is, beside two main sources in the plant kingdom, is found exclusively in animal products. And cholesterol, which is only found in animal foods. They causes your cholesterol to rise, which damages the endothelial cells, which does not allow the nitrous oxide to be produced to allow your arterial walls to relax. So your blood pressure starts to rise. That's the second way. And the third way is water retention. Water retention due to high sodium intake, low potassium intake, and your minerals just being basically off. You know, you're not getting enough magnesium, enough potassium, enough calcium. And people say, well, enough calcium, you know, well, I drink milk all the time, or I eat cheese. Well, milk, dairy products in general, have a low absorption rate for calcium. The best sources of calcium are green leafy vegetables. But going back to just what I was talking about, those are the three main ways that your blood pressure goes up. So when I found that out, I wanted to try to attack, and correct those three problems. Well, I had my blood sugar levels tested, and I've never had I was never diagnosed with diabetes or anything like that, but I was diagnosed with metabolic syndrome, which my blood sugar levels were a little high, but they were just saying that I would have to watch what I eat and stuff like that. Well, my blood sugar levels at one point was resting at 107. As of recently, I had my blood sugars tested and it was resting at 60, well within the normal range, and it's due to finding out what to eat. So I took care of that function, and then I took care of the cholesterol. That was the easiest. You just avoid saturated fat and animal products, and your cholesterol drops better than taking any kind of medicine for it. In fact, you'll get to optimal levels to avoid heart disease and buildup of plaque in the arteries. Your LDL, which is the bad cholesterol, needs to be somewhere below 70. So your total cholesterol needs to be below 150, and your LDL needs to be below 70. That is it can only be achieved one of two ways. Either you're on a high amount of medication, or you're on a whole food plant-based diet with low sodium, low in fat, and low in oils. And the third way is the endothelial cell function. The endothelial cell function can be rectified by eating foods high in antioxidants, like blueberries, amla, which is Indian gooseberries, Ceylon cinnamon, basically any of your fruits and vegetables. I mean, green leafy vegetables is a must. Beans daily is a must in order to get enough nitrous oxide to relax the arterial function. Certain spices work really well, like turmeric and cayenne pepper. But those three things, if you eat a whole food plant-based diet and you work with trying to cut back on processed foods, you want to eat whole, real foods. That's the best way, and that's what worked for me to lower my blood pressure. You should try it for yourself. I hope it works for you. Like and subscribe and leave comments. Let me know what you think or if you have any other questions.